It's an enormous pleasure now to be able to speak about our next inductee, Dr. Neal Lonky. Dr. Lonky, an MPH graduate of our school's Department of Health Policy and Management, has pushed the boundaries in his field of obstetrics and gynecology with the development of patented surgical tools and technology used in screening and diagnosis of cell abnormalities and cancer to save lives. He's an extraordinary clinician. He's practiced OBGYN in Southern California, in the Permanente medical group. He's been assistant chief of service for the Department of Obstetrics and Gynecology, as well as being an inventor and innovator. He holds numerous patents for devices, tools, and procedures used in obstetrics and gynecology practice. He's taught as well, clinical professor of obstetrics and gynecology, and beyond that, he's really done extraordinary service in the best meaning of the terms, both locally and globally. So globally, he's volunteered his time to care for patients and trained physicians in the prevention and treatment of cervical cancer in women in China, the Philippines, Korea, Taiwan, Mexico, and Singapore. And for those who aren't aware, cervical cancer is one of the leading causes of death preventable death and preventable years of life lost in many parts of the world. And for more than a decade, Dr. Lonky has volunteered for the National Alliance on Mental Illness in Santa Ana, California, which aims to improve the lives of individuals and families affected by mental illness. He provides assistance with policy issues, grant writing, and fundraising, again, bringing to life this notion that you can have deep impacts in your service work locally, globally, at the same time as extraordinary leadership in your career. So please join me in congratulating Dr. Neal Lonky.
I'm tall. I'm one of the tall guys. So I want to thank Deborah Breslow for originating this with Dr. Breslow and Dean Hyman, the faculty, the staff. It's a true honor and privilege to come back here. It's been a while, almost 20 years. I tried to figure it out. I was in the first class of the executive program, and I have a debt of gratitude to Dr. Torrance, who's not here today. It was such a gift to come here at a time in my career when I was trying to really figure out what I wanted to do for a living. And I'd already been in a leadership position at Kaiser Permanente, and I was doing research and teaching. I had started to do some of the volunteer work around the country, and also had started up a company. I have my brother in attendance, Stuart, my other brother, Marty. We started a company back in Torrance in the late 80s, sort of founded on the principle that you could make a difference and you could be successful in business. And it kind of taught me that you have to be not only thinking about the public service, but you have to be thinking about how you're going to pay for it all. Because when you take the entrepreneurial step of inventing and then trying to apply those inventions to the world, you really are accountable. You're taking risk. So I think we're going to have to take some risks in environmental health and really put the rubber to the road to make a difference there. I'm going to take you on a journey a little bit about how it came to be that I was able to accomplish some of the things I did. I didn't do it alone. All the mental health services stuff was led by my wife, NAMI, who is on the mental health board for Orange County eventually. And she's here in attendance too. So here I was, a doctor trained at Harbor, UCLA, and had come from New York City in Stony Brook, New York, and came to practice eventually at Kaiser Permanente in Orange County, and I saw a real opportunity for making a difference. And I was doing things in my department, trying to bring my department forward, and I saw that I needed to have more skills because I saw that we needed to find the value in healthcare to move healthcare forward. So I came to the School of Public Health with a research background in cervical cancer and some acumen in business, but I really integrated it here. I think the leadership class in the School of Public Health for the executive program really solidifies, helps you figure out who you are and who you want to be. And I figured out that I was basically, like my dad, a builder of things that needed to be value-driven. And in healthcare, it happens to be quality service access over cost. So I was elected to the board of directors after finishing the program here, and for 15 years I've been reelected. And I've helped, I'm certainly not going to take credit for it, this is some tremendous people, but I've helped kind of sharpen, I've done some work with the registries as well here in Southern California, but I've sharpened the quality, the caring with a personal touch, making Permanente medicine convenient and easy and affordable. And I think it's no mystery that our groups, both in North, Southern California, around the country, are looked at as the model for potentially what healthcare redesign could be in the United States, because we have that value-driven ethic. So when I became a board member and started to figure out and actually look at the budgets and financials, and we really did invest in the right things, and you can see we're growing. But on the other side of the equation, we had some pitfalls with the business. And I'm happy to say that we've kind of relaunched our business with cervical cancer prevention. A lot of the volunteerism that you hear that I did was also based on sort of teaching new ideas about screening and treatment and triage of cancer. And hopefully it will continue to make a difference. But personally in my life, at the same time that was going on, my oldest son was afflicted with autism. He was actually diagnosed here and right here. And also I have stepsons who suffer from mental illness. And you can be a victim or you can make a difference. And I think for my wife and I, we tried to figure out how we can make a difference, both first with the Autism Society of America and then through the National Alliance on Mental Illness. And I'll conclude with this. There was a real problem, and I think a lot of the behavioral health underpinnings of why we have so many violent attacks in the United States have to do with the mental health system in the United States, not recognizing truly how we can prevent it. And there was this little kindling of an idea before when we started about assisted outpatient treatment, where we would actually try to circumvent, especially people who are coming out of the prison system, coming back into the community, we could circumvent how to prevent some of the relapses, the recidivism, the noncompliance and medication use. And we got involved. And unfortunately, it took the death of a homeless man in Fullerton under police custody to kindle some interest in this. And one by one, the county legislators funded, which was an unfunded mandate in California, to have Laura's Law enacted in many of the counties, including Los Angeles, Orange County. So you can make a difference if you get behind something, you try to figure it out, try to find what motivates, try to find the proper funding. Timing is everything, as Dr. Jackson said. Politics sometimes trumps being smart. And I think that you have to do it all, and you have to take it all in and use every ounce of training and experience you have. And I can tell you that if I truly value the time I had here. I learned so much from the people that came in to talk to us, our faculty, and especially my classmates who were leaders. You know, they were people trying to figure out the same thing I was. So it's a special thing to have the executive program for working professionals, because we figured out that we can get the tools we need. So thank you so much.